Thank you for joining me today. In this video, you will learn more about Ambien. Ambien is a medication for insomnia. It improves sleep. And I have a case study based on Ambien. So, a 28 years old female presented to the primary clinic with a complaint of persistent insomnia over the past 3 months. She works full-time as a marketing coordinator. That's her job. And she reported increased workload and stress. Past medical history is unremarkable, so she don't have a past medical history, and she has no history of a depression, anxiety, or substance use disorder, or sleep apnea. She don't have all these medical conditions. She does not smoke or drink alcohol socially, but denies nightly usage. Currently, her medication include daily multivitamin, and she is not pregnant. Symptoms she presented with include difficulty initiating sleep. Sleep will take her 2 to 3 hours to fall asleep most of the night. Frequently, nighttime frustration. She has a fragmented nighttime frustration and daily fatigue. She has a difficulty concentrating at work due to a poor sleep. She has a poor sleep. It's hard for her to concentrate her work. It's hard for her to sleep normally at night time. It takes 3 hours to fall asleep. She has a headache occurring several mornings per week. So every week she has a couple times that she has a headache. She reports sleep approximately 4 hours per night and denies snoring and insomnia. She also denies insomnia. She denies restless leg syndrome, nightmare, or panic. She denies all that. She has attempted sleep hygiene measures include limiting caffeine, reduce screen time, maintain a bedtime routine with minimal improvement. So no matter what she tries, she's not sleeping normally. Okay. Clinical assessment. Mental status exam is normal aside from the fatigue. Mood is appropriate with no sign of depression or anxiety. But sleep scale Epworth sleep scale indicate a clinical significant sleep disturbance. Clinically significant sleep disturbance. And here you use the Epworth sleep scale. There is a scale that you can use to measure how much the patient is sleeping. Findings are consistent with a short-term insomnia and primarily characteristic by difficulty with sleep initiation. The reason you choose Ambien is for short-term management of symptoms like acute and situational relief to relate to stress rather than chronic insomnia. So she don't have a chronic insomnia. This insomnia is situational and stress related. Non-pharmacologic interventions have been attempted with limited success. That is the reason you choose Ambien, and Ambien has demonstrated effectiveness for sleep-onset insomnia. Compared with the benzo, Ambien has a less impact on a sleep achievements, lower risk of a next day sedation when used appropriately. So next day you will not be sedated, you can work. The patient prefer medication intended for intermediate use rather than a daily long-term therapy. So Ambien was prescribed at the lowest effective dose to be used as needed. So she will use as needed. If she can sleep, she don't have to use it. When she tried the sleep hygiene and she couldn't sleep, that's when she uses as needed for this medication. So patient education include that the patient counseling extensively on appropriate use and safety of this medication. The medication purpose is a sedative used for short-term treatment of insomnia. How to administer this medication, you will teach the patient how they can take this medication. Take immediately before bed. Ensure at least 7 to 8 hours available for sleep, because you don't want to take the medication and you are planning to wake up sooner to do work or to do anything. You have to have a time to fall asleep. So it has to be when you take the medication and when you planning to wake up, it has to be at least 8 hours available for sleep. Use only when able to sleep and interrupted. And common side effects, you will teach the patient the common side effects of this medication, which include drowsiness, dizziness, headache, nausea. There is also severe side effects on this medication. That is potential for complex sleep behavior like sleepwalking. Some people have seen when they take Ambien, they sleepwalk, they sleep and drive. Those are serious risks. Risk increase with alcohol or other central nerve depressant medications. If you take alcohol or if you take central nerve depressant medication or sedative medication, risk increases. Sleepwalking increases, sleep driving increases. Those are the serious risks that can this medication cause. You will also teach the patient safety precaution. Avoid alcohol when you take an Ambien. Do not take with other sedative medications. Do not drive or engage in hazardous activity that morning after usage. So don't do that after you take the medication. Duration of a therapy, you will teach how long it will take this medication to be effective and intended for short-term use. This medication is short-term use. The patient has to verbalize understanding of what you are teaching, and they have to agree to follow the safety guidelines. You want to also clinical monitoring. You have to monitor the sleep onset, length, and total sleep time, daytime alertness, and cognitive function. That's what you want to monitor. Next day, sedation or impairment. You want to monitor those. Abnormal nighttime behavior. You want to monitor those. Sign of medication misusage or tolerant. You want to also monitor that. Lab monitor. No routine lab monitor required for Ambien in otherwise a healthy adult patient. Baseline liver function. Consider if the prolonged use becomes necessary or a liver disease develops. Monitor medication profile for interaction with other central nervous system depressants. You want to teach the patient the treatment outcome, and you want to go over with that treatment outcome so they can know what to expect. You will set up a follow-up appointment after 4 weeks, and the patient, you want to check if the patient report is falling asleep within a 30 to 40 minutes on a night is when they use Ambien. You want to see improvement in total sleep time of approximately 7 hours, at least 7 hours or more. Improve the daytime energy and concentration. Also, you want to see no episode of sleepwalking, insomnia, or next day impairment. You don't want to see that. So after you have a follow-up appointment with her 4 weeks, she reported using Ambien 2 times per week, primarily during a higher stress days. No adverse effects were reported. She didn't report that any adverse effect. You want to have a follow-up appointments. This is what you teach the patient: to continue Ambien as needed, limit to a short-term use only. You want to encourage them to schedule and have cognitive behavior strategy for insomnia and stress management. You want to encourage consistent sleep schedule and avoid a late caffeine usage. You want to reassess sleep pattern and medication use for the next 4 to 6 weeks. You want to discontinue Ambien once the sleep stabilized. This is not a long term, it's short term. So you want to discontinue when you see the patient is sleeping okay. Consider referral to behavioral sleep medicine if insomnia persists beyond 3 months. Thank you for joining me today, and I would love to see you in my next video. Please subscribe and like the video, and see you next. Thank you.